Hello, hello. Have a seat, make yourself comfortable, and welcome to another one of our webinars on health equity by us, the DSA, the Division of Social Accountability. We are a unit in the College of Medicine at the University of Saskatchewan that is mandated with embedding health equity frameworks, anti-racism and anti-oppression, as well as principles of community engagement at all levels of learning in the college, as well as to build relationships with systems and communities to improve the health outcomes and make sure that our institution is prioritizing the health concerns of the communities that we serve. So we we have these spaces, these webinars, as a way to connect with community, with faculty, with students. Who we have many student advocates, and this is what we do. And today we are, of course, celebrating and commemorating not just National Indigenous History Month, but also Pride Month, in which we really celebrate the gains on justice and equity for queer communities, for all the gender and sexually diverse communities, and all the folks whose experience still have not been named. And we really want to recognize all the struggles and the gains, and also, remember the people that we have lost and remember them with love and with responsibility. So, of course, we gather today virtually, but the Division of Social Accountability is a secular unit within a colonial institution. So we like to start our conversations by grounding ourselves on the understanding and the recognition that we are on Indigenous lands, that these are treaties. We are ourselves working from Treaty 6 territory, the homeland of the Métis, and the ancestral land of many Indigenous peoples, like the Nehiyo, Nakota, Dene, Lakota, Dene, Soro, and other Indigenous people who have gathered here for millennia, time immemorial, and that this place has much significance. So we really want to first set up the space in which we understand where we are, what our intentions are, and why we're here. My name is Manuela Valle-Castro. I'm the director of the DSA, and here are some of my dear colleagues, like Erin Walling. And we're very excited again to have this amazing panel of people that we invited today. So I'm going to let them introduce themselves briefly, but I do want to say that we're very excited to have, again, representation from such amazing organizations like Out Saskatoon, who we value and recognize and work with so much, and advocates and activists from the community like Jordy, who are visibly always having a face and a voice for Two-Spirit and Indigenous people and queer people. And of course, Dr. Madill, who has been working and enduring university work for many years, and has been advocating as well. And I think enduring is the right thing to say. We need to acknowledge that we do work in spaces that are very, very colonial, very patriarchal, very homophobic and transphobic, where there's been underwritten norms of professionalism and respectability that have really impacted our ability to participate fully and joyfully in these spaces and with all of our dimensions as humans. So I'm gonna shut my front door now, because I'm very excited to first introduce. Could I ask then Dr. Madill to maybe go first, and then we'll be followed by Jordy, and then last but not least at all, Jemma Martens from Out Saskatoon. And please take it away.
Thank you. Thank you, Manuela. Yes, I'm Stephanie Madill. I am faculty in the School of Rehabilitation Medicine. I trained first as a physiotherapist, and then did my graduate work in biomechanics. And I've been at the University of Saskatchewan since 2011, I think. And so I've been asked to talk about queer health in the province. And so I'm going to root it in the research that I've been doing with wonderful others over the past while that reflects on it. And the biggest one is that we've been running the Trans Project, which piloted 2 health navigators for people who are trans and gender diverse, one housed here in Saskatoon and one in Regina. A brief history of that project is back in 2018, the Saskatchewan Trans Health Coalition was formed. And it was a combination of groups like Out Saskatoon and You Are Pride, healthcare providers who work with people who are trans and gender diverse, and people from the trans community as well. And they got together and with a strong desire collectively to improve trans health in the province, and decided that they needed research. And so I was asked to join because of my research experience and because of my university position, which lets me hold grant money. So I was asked to join that project, and I've been co-leading it with Megan Clark, who's a family doctor in the academic family medicine unit in Regina. And we decided as a group that what was most important was something that would not just find out about the community, but actually help the community. And really quickly came to the decision that navigators, healthcare navigators, were the best choice. And so the 2 navigators started last April and ran for a year. And the short answer to how did it go was way too well. We had no expectation that it would be as successful as it would be. I mean, we were hopeful, but we were blown out of the water, and that we didn't have contingency plans in place for the end of the project, which left people a little bit startled and kind of panicked. But the navigators, first of all, did what we'd planned. So they helped people find healthcare providers who are safe and affirming and knowledgeable. They helped people plan how to talk to healthcare providers, because often they had, say, a family doctor, but were uncomfortable coming out or asking about things. So they developed scripts to help people with those conversations. They connected people to other resources, but they also worked in response to the community, which was amazing. And so some of the things they did were to set up a trans-friendly COVID vaccine clinic, because they were hearing that their clients were uncomfortable going to the regular vaccine clinics to get vaccinated against COVID. So they set up a clinic. And the other thing they noticed quickly was that lots of their clients were having difficulties because their ID didn't match their current identities, and they needed to change their gender markers on various government issued things. And that's a pain and a half. And so they both became notaries public and set up clinics through in partnership with people in law at the university to make sure that the boxes were ticked and they were doing it properly, to help people get their forms signed and notarized and everything all ready so that they could get those their ID changed. And also, we didn't plan to do this in a pandemic, but they knew, clearly the university knows that we like a challenge. And so it all ran virtually, and we're really surprised at how well that worked. I mean, obviously they liked when they could working with clients in person, but it was remarkably successful. And I think perhaps because so much was done virtually, they were able to reach more people through presentations and things, because it's easier to log into Zoom than it is to get yourself over to a meeting room at the library at 7:00 at night for something. Yeah, so it does. They tried to make it as accessible as possible. So they ended in April for the study part, and we're now in the ongoing analysis of how well it worked so that we can put that into concrete form and use it as a bit of a brick to help persuade people to fund these long term. And we also were able to secure bridge funding with SASK to keep the positions going for longer, and the community-based organizations are applying for a little bit more bridge funding while we're in talks with people at the Ministry of Health to make these permanent positions. We're suggesting there should be 3 of them, and that they should still be geographically focused, and that they need to be within the health infrastructure, within the institutions, to be taken seriously by healthcare providers. And that was a really strong finding. The other thing I've been doing is working within the College of Medicine to improve the queer content in the undergraduate medical education. And so we started last summer with 2 Dean's projects, and I supervised them with Carla Hollanati, who's an amazing academic family medicine doc here. And one did a literature review of best practices, and the other did a review of the curriculum here. And basically they found that there aren't really any best practices because nobody's really evaluated a thorough program change to try and queer a curriculum. And that we're doing okay already, that the North American average for number of hours devoted in a 4-year undergraduate medical program to queer health is about 5, and we're at nearly 11. So we've already got lots of time worked in. And so it's just scaffolding and getting things so topics build. We found that they were presented out of order. So it's working with instructors and course coordinators to get the topics so they build and spiral on each other, and to use those 11 hours as effectively as possible so that people are getting all the information they need. And I think that's the most of what I've got to say. And I shall pass on to someone else, unless, Manuela, do we want to open for questions now or at the end?
We will have questions at the end, but thank you so much for sharing your work with the Trans Health Navigator and with the Queering the Curriculum project. I think that people will have questions, and I just personally want to thank you so much for all the work that you've done and the impact that it has. I think you can't even imagine yet how many families have and will be impacted by this. So Jordy, can I invite you then to share about your maybe past and present work? And
yes, definitely. I do apologize for this is me, Jinx, who, if I don't let be on me, will claw into me this whole entire conversation.
Co-panelist.
So this is me, Jinx, my son, and Amba washte Jordy wechampi mazo mogiabi namakota wecha metago abisha kina ida hambi. Good day, folks. My name is Jordy Ironstar. I use he, they pronouns, and I am the Community Readiness Coordinator for CAAN Community Alliances and Networks, previously known as Canadian Aboriginal AIDS Network. And through my work, I aim, or I hope to empower Indigenous organizations, communities, and people to make informed decisions when it comes to their response to health, specifically with HIV/AIDS, and do things in a harm reductive lens and a way that is rooted in ceremony and protocols, and through our Indigenous ways of knowing and doing. Beyond that, I am also the Two-Spirit Ambassador for Fierté Canada Pride. So I do a lot of work within the Two-Spirit, Indigenous, Queer, LGBTQIA, Indigenous people, supporting my kin in whichever way I can, and that typically involves a whole lot of networking, which I guess is fun. But yeah, so a lot of my work is rooted is very community-based level when it comes to health and when it comes to the queer community.
Jordy, can you share with us what are some of the main barriers that you have learned about, especially that are more specific for Indigenous, Two-Spirit, and queer folks in accessing healthcare?
Definitely. One of them, a big one would be a lack of cultural awareness about Two-Spirit people. I think the term Two-Spirit is relatively speaking new. It's about 30 years old at this point, but I don't know how many times I still get asked the question, literally up until this week, what does Two-Spirit mean? Who are Two-Spirit people? And that comes from both the Indigenous and non-Indigenous community. I think that there are stigmas that still exist around cultural erasure, and I think another really big one is not being able to see ourselves within healthcare. I think that something that I bring up a lot is when we talk about, and something that I'm not afraid to call out either, is I think when we look at things at a government level, or these colonial institutions, I think when we talk about the queer community, it's often LGBTQ plus, and 2S is thrown in with the Q, or it's almost like Two-Spirit or Indigenous people are an afterthought when it comes to that kind of overall mainstream community. So we typically don't see a lot of ourselves, a lot of visual representation. And that's a big barrier as well, because then we feel like that's not a space for us, or if we can't see ourselves there, then why would we try access it?
And I was also wondering if you have any thoughts on what are the impacts of colonialism on Indigenous people, on also developing kind of homophobia and transphobia, and a lot of internalized oppression about sexuality. If you have any thoughts on that as well, on one side, kind of the racism in the predominantly white healthcare system, but what are the barriers that you see in terms of how people have been affected by colonialism?
Sorry, can you hear me?
Yeah.
Okay, sorry, I got a phone call and now my screen's all messed up, but I'll roll with the punches. That is a very, very good question, and that is I have insanely deep conversations about this all the time when it comes to how colonialism has affected Two-Spirit people, both in and outside of our communities. Right. And I think the big one that I'll focus on today is within our communities. Ceremony is healthcare for us. It is our medicine, our pazuda, all of that, access to elders. That is ceremony, that is healthcare for us. And if it wasn't for my connection to my culture, I think that I would be in a completely different place than I am today. And how I got to where I am today, to be able to speak for or with my community and be so visible and be comfortable in that visibility. How I got to where I am was I had to do a lot of searching for where it was safe for me to really reconnect with my indigeneity, and the fact that there's maybe one Two-Spirit knowledge keeper or elder in each province, like the amount is very, there's not a whole lot. So I think that they're stretched thin when it comes to supporting their community members. So something that I just had a conversation about yesterday at a Two-Spirit gathering was like, how do we educate non-queer elders so that they are a safe space for us, where we're not going to be misgendered, or we're not going to be, you know, our gender or sexual identities are not going to be questioned. Because a lot of our ceremony conductors like kind of still think in a very binary way, very man-woman, like women sit on this side, men sit on this side, and it's like you have to choose. And I don't want to have to choose whether I want to be with my sisters or be with my brothers, because I kind of, as a Two-Spirit person, I flow between both. So someone saying like you have to pick in order to access these ceremonies, in order to access our healthcare, it's not a comfortable feeling. I guess I'll leave it out there for now.
Thank you so much, Jordy. I'm pretty sure folks will have more questions at the end, but thank you so much, because this is something that in our conversations about queer health, we don't want to have it as an afterthought. We want to have it front and center, again, because we are grounded on the understanding that we are occupying and uninvited guests in Indigenous land, and we do have responsibilities. And also because I think that we need to start talking about those kind of like unique experiences that cannot be just like, as you were saying, sometimes for some purposes, for policy or advocacy, we bag things on one umbrella, but it's important to understand that that doesn't mean that everybody has the same experience, right? So I really appreciate what you were saying. And I'm going to invite Jemma then, who is one of those stellar trans health navigators that Stephanie was talking about. We're very eager to learn about you and about the work that you do, Jemma. Thanks for being here.
Yeah, I'm happy to be here. So my name is Jemma. I use she, her pronouns, and I'm the peer navigator at Out Saskatoon. So I'll chat with folks about their gender, their identity, provide peer support to folks who may be struggling or have questions. And I provide system navigation, which in part is where the health navigating comes from. And I have worked very closely with the Trans Health Navigator. And even right now, I'm working, or one of them is helping me. And their work is vital and it is needed. And I would actually like to share my experience, my personal experience that I'm going through right now. So 16 days ago, I had a vaginoplasty with canal surgery finished, and it's done in Montreal. The application process took a couple years, which is relatively short because it can take several years, up to several years for someone to go through it. The surgery costs were not fully covered by the government. So plane tickets, PCR testing, aftercare products, the idea that there's universal health care in Canada isn't completely true when it comes to trans health. So I'm very privileged. I'm able to pay for plane tickets to Montreal. I'm able to have a financial cushion in case something goes wrong in Montreal, that I can spend money to stay there. I needed to advocate for myself through the process to a significant degree. So communicating with the ministry on the status of my funding, with the staff in Montreal, with actually finding doctors who even knew how to provide HRT in the first place. that's almost a separate story. But the process of medically transitioning from starting hormones to a vaginoplasty for myself was a series of cold calls to doctors asking if they knew what to do. Not just in Saskatoon, but in other cities in the province. And in all of the cases, they would say they didn't know what to do and they didn't know who to refer me to get this information. I actually learned from Mount Saskatoon's website rather than my GP or any of the number of doctors that I called and talked to. They literally were telling me they did not know what to do. And I think that there are a few lessons in my experiences that future healthcare providers can learn from. That gender affirming healthcare is life-saving. It prevents suffering and death. Full stop. It saves lives. The process for getting a vaginoplasty done, it's very complicated and it takes a long time. And I'm privileged in that I had help to go through this process. A lot of the people that I've worked with throughout Saskatoon, they don't have that. They don't have a phone. They don't have email. They can't rely on technology to do these things. They don't have supportive family, for example. They don't have supportive doctors. Advocating for patients if they're navigating through this often confusing system is really important. I was lucky in that eventually I found a doctor who could help me. That's not always the case for other people. I think one of the biggest things is that there are no surgeons in Saskatchewan who do this surgery. They are basically in Montreal. So again, I'm privileged in that I was able to travel to Montreal and stay there for 10 days and then travel back. A lot of people can't do that. The cost of traveling is not covered by the government. Not everybody has support people who can join them. It's very difficult to try and get this surgery and follow it through to its completion. Aftercare takes 6 hours a day every day for the first month afterward, and then gradually lessens over the next couple of months. It is very time consuming and does require support. And the last thing that I would have wanted to be thinking about is what happens if I catch COVID while I'm over there and I have to spend money to stay there in isolation because that's not covered by the government. What do I do? I can handle that personally, but a lot of people can't. It's impossible, actually. And I'm relying on one of the trans health navigators right now to just talk to. I just talk to him through this process because aftercare, it's lonely. It's very busy. It's very different. And when I heard that they were, like their contract was coming up and was about to expire, I was worried. I thought, okay, if and when they leave, I'm going to be having individuals asking me for the support that they are offering. And so I was starting to take on some of their workload, fearing that, well, I can't have a disruption in services because this is too important to put people on the back burner. They're already put on the back burner. The last lesson that I haven't really talked about much, but is a very big issue, is that I hope and pray that healthcare practitioners will learn how to start individuals on HRT. how to medically transition, because the amount of doctors who say that they don't know what to do is almost breathtaking in the damage that it causes, in, for me, the surprise and shock and eventually desperation for hearing that, because again, it is life-saving and it prevents suffering and death. And that's a little bit of my story that I wanted to share.
Jemma, I think you have said something that I hope that everybody wrote down in capital letters in their notebooks, which is gender affirming care saves lives and prevents suffering. And I stick with that because that's the only thing that should matter, right? That we are able to provide care for folks that prevents their suffering. And it's very enlightening, and I really, really want to thank you for sharing your very personal experience in such a public forum. I can't imagine that can be comfortable, but I really appreciate that you're able to share with us the barriers, the difficulties, and how, I think that there's something that I should have said when we started our conversation, and it's that we need to first name and acknowledge that historically there has been a complicity of medical and physicians and the medical discipline, right, in pathologizing queer folks. And nobody has done this obviously with like evil intent, one wants to think, right? But there's a legacy, right, of looking at queer folks as a pathologized, criminalized, tragic kind of like existence, which is something that I being a Gen Xer and having being steeped in all that cultural narrative about the tragic, trans existence, as opposed to, if you just provide care, then it doesn't have to be tragic, right? And I really like what you're saying about, because a lot of people think that when we're talking about trans issues, it's like, oh, we just have to use the right pronouns so people don't get offended. And it's like, no, actually, trans youth is overrepresented in homelessness. 40% of our homeless youth is because they're queer, they ended up in the streets. Queer people are overrepresented in poverty, in rates of violence, in unemployment, in suicide. Right? We're talking about life and death, about poverty, about access to basic social and human rights, right? It's not about getting offended, no, it's something way more concrete and material, right? Well, I'm going to open it up first. Those are just my initial thoughts. I'm very, very grateful for everything that you have shared. And I thought it was interesting to ask ourselves, why do we need a trans health navigator to begin with? What needs to be navigated that, right? So I don't know if anybody wants to take a stab at that question, and maybe we can open it up to our audience too.
I'll take a stab at that question. And I think it's exactly what Jemma was saying, that the processes are just too complicated and people don't know at all these levels. And so things were taking ridiculously long times and people were suffering. I think it's as simple as that. And our discussions about what we were going to do when it was decided that we wanted to do something that would have an effect. I think the first suggestion was navigators, and everybody just went, yeah, that's it. It didn't need a further elaboration because it was so clear, particularly to the community members in our research, that's there. And so our navigators worked alongside Jemma to be focused just on, well, I say just on healthcare, but to be more specifically focus on healthcare and not replicate Jemma's job, but to take a burden off of her and to be more specialized on healthcare. Would you agree, Jemma?
Yes, 100%. My role on a day-to-day is I'll work in office in out Saskatoon. I will help with the drop-in. So folks who may come for a cup of coffee and want to chat about something, to somebody who's in a crisis and needs to talk about maybe their parents kicked them out of their home because they came out as queer, to maybe parents are calling me asking, my child just came out, what do I do? So they're not specifically healthcare related, but they are close. I kind of think of my work as a little bit of counseling and social work, although I am neither of those. And the work that the trans health navigators do, they talk to doctors specifically. They look for doctors who can help. I had an individual in a remote community who was supporting a 10-year-old youth who came out, and this support worker didn't know how to find a doctor. And they called me because they saw out Saskatoon. And I wasn't exactly sure about the landscape of doctors in the province. So I contacted our health navigators, and they ran with it. So while I was providing the individual support to the youth, they were finding doctors and those connections to eventually get him to see a doctor and not have to wait a year or more.
I mean, we were talking about like the possibility of doing this remotely. I mean, the fact that we have a province that is 50% rural, right, and that we don't have a public transport system anymore, right, really makes it more dire, right? This need for information in rural and remote communities. And okay, but I wonder if there's actually questions from the audience.
Can I just add something?
Yes, please.
On that last question, I really, any chance I get, I really just like have to give an applause to the team at Out Saskatoon. Yesterday, we were at a Two-Spirit gathering, a Saskatchewan Two-Spirit gathering that was hosted in Whitecap at Dakota Dunes Resort, and that's a conversation I had with the folks at that conference. Was when it as myself and a lot of my Two-Spirit kin have been all across Saskatchewan, have been working over the past 3 months on building a Saskatchewan Two-Spirit network, like really establishing like a formal kind of community channel, so that we can continue to support Two-Spirit people, especially up north. Like you said, a lot of those communities can be very isolating, not just the First Nations community, but there are a lot of Métis settlements up there as well. And I think that, for somebody, I've worked with Saskatoon Pride in the past, in the Pride home, and so I see firsthand, and then also as somebody like outside the organization, all of the work that they do, that they pick up, and everybody, whether it's like Two-Spirit people, whether it's trans people, or just somebody that wants to support somebody within the 2S LGBTQIA umbrella. Everybody runs to Out Saskatoon because like Out Saskatoon is that beacon right now, and like the only point of reference that a lot of people have in Saskatchewan. So that being said, there is definitely a need for more Two-Spirit organizations, trans organizations. Like we need more capacity within our province to support everybody, because not that it's only Out Saskatoon doing it, but I know everybody like runs to Saskatoon for all of those needs. And that's where I ran for my needs when I first started kind of being more of a visible person within the Two-Spirit community. And that's really where I found my strength was through the programming at Saskatoon. And the last thing that I wanted to mention when it comes to Trans Health Navigators, one thing that it was such a beautiful, beautiful project. And I really do hope that, like, fingers crossed, praying that becomes like a more permanent fixture. And the thing that I really appreciated about that program is it was really kind of that by us for us thing happening there, where people who access that service were meeting face to face or like virtually or on call with trans identifying individuals. And like I had mentioned earlier, seeing that representation is so important. And like, so having somebody helping you through the process where you know that they can identify with that same background is very, very important. And yeah, so amazing program.
We have all the love of the world for our friends at Out Saskatoon. Oh, somebody's asking if they're similar to Out Saskatoon in Alberta.
Yes, there are big organizations in Edmonton and Calgary, and I think Lethbridge, and I'm not entirely sure about other smaller communities. And I can only remember the 3 names ago name of the one in Edmonton. It's not coming to the top of my head, but they do. In terms of the navigators in Alberta, their services are much more limited to basically providing scripts and maps. So there are a list of online resources that include scripts, but there isn't any personal navigation service. And that's only one person in the province. And there is in Edmonton a big ongoing multi-year both research and general, support services for queer youth that has a drop-in center downtown in Edmonton. And of course, I can't remember the name of that off the top of my head either. But yes, there are similar things. Probably the best organized in terms of trans services would be Transcare BC. And they're currently the only province-wide one. And we've worked with them and we've very much been driven by the nothing about us without us philosophy and by not reinventing the wheel. And so our navigators were mentored by navigators at Transcare BC.
I wonder if we have medical students or just students or practitioners or other community advocates or faculty. If you have, please feel absolutely free to pose your questions to our panelists today. They're here to share their information and knowledge. If you're feeling shy, you can also type it in the chat. People are feeling shy, I guess. Still digesting the information.
Manuela, while there's a moment while people are gathering their thoughts, can I just add a few things about what we have going on this month as a division? And I am happy to share that Jemma has kindly offered to facilitate our book club this month with me. And so there's one session the evening of the 23rd, as well as the morning of the 24th. And we are going to be discussing the book Becoming Nicole, which is an amazing true story of Nicole Maines, who now is an actress and is the first transgender person that's a superhero in the show Supergirl. And it really is a great story of the I guess her journey and her twin brother and her family, but it really lovely interweaves legislation at the time and that they were challenging, as well as quite a bit of information about the medical transition that Nicole was going through. So it's a really wonderful book. I have learned a ton myself in reading it, and I look forward to the opportunity to chat about it with others who are interested. We do have some people who joined up, but there's certainly still lots of space. We'll just put I think Joanna, thank you. She already put a link in the chat there if anyone's interested in signing up. That would be lovely to have a part of the conversation.
Thank you. That's a great reminder. Kate, Stephanie, do you want to respond to Kate's question, but share it for the public? Because Kate Dunn works for the South Cancer Agency and is asking, still under new guidelines being established for cervical cancer screening, do you have any advice for our team? Okay, so Stephanie, you can provide more.
Yeah, and I'll just say out loud that I know that there is a research team in the province that's also looking at making cervical cancer screening more accessible, and we have been working with them for this exactly is to make it more inclusive. And my email, because I just realized I didn't put in it, is stephanie.madill@usask.ca. It's not imaginative at all.
Connections. This is what we also would hope that we would be doing in person, right? Networking a little bit and establishing more relationships between advocates and people who want to become involved. And Natalia is posing you a really fun question there. Let's hear. You have a magic wand to improve access to healthcare. Ooh.
I think this might be like a very obvious answer, but just through previous experience, I would really like to see the gender binary be taken completely out of paperwork. I know trying to visit some of my youth that I worked with in the past, like how many times when they're in the hospital, how many times they would get misgendered over and over and over again because they had a different gender on their paperwork or on their ID. And it's just like crazy to me that's still a thing. And it's such an easy fix. It's like such a incredibly easy fix that I just don't understand why that's not happening. Or even going as far, well, not as far, but in the same hand, names, not dead naming somebody. It's as easy as adding in a line in your paperwork saying, like, please use this name. And it's still not done, which is just crazy to me.
If I could wave a magic wand, I would have a surgeon who can perform the vaginoplasties and phalloplasties practice in Saskatchewan. They would actually be a great service to Canada, not just the people who live in this province.
I'm going to go larger in scale, but way more mundane in practice. And I would have every healthcare provider and healthcare administrator and office person and etc., anybody who works in healthcare in the province, do 2S LGBTQ cultural training and appropriate catch up on what they ought to have known all along, basic education. So I'd send them all back to school for a few days.
I really like that, and I would add that if I'm taking the magic wand too for a second, because I want to second that. I want my desire to be that every health practitioner, every person that is in a point of access to healthcare is absolutely competent and safe for any trans person to go to. It's able to serve the needs of any queer and trans two-spirit person. Okay, we have, okay. So there's a question there from Jocelyn, and I think that Jemma also replied to. Do you want to say anything else about that?
I would just add that it's still 2 letters in addition to your primary care doctor, but they've opened up who can provide them. And that list is growing slowly. I know that Megan Clark in Regina, who's a family doctor, can, but they've opened up who can provide those letters from beyond just psychiatrists to other people who I'm not sure if there's a specific thing they have to, like training they have to do or something like that, but it's opening and that number is growing. And that list is on the province's website, or contact one of our navigators.
There's still time for more questions. If people are still having questions, I also wanted to share that tomorrow the DSA and the College of Medicine students and faculty, we will be marching at the Pride Parade along with the Saskatchewan Medical Association. We have our banner, and there's a bunch of students that will be there too. They wanted to wear the white coats, but then they're wondering if that will be both too hot and potentially triggering to some people. So I think they're not going to wear their white coats, I think, but we're all going to be there and showing our commitment to improving healthcare access and the quality of healthcare for everyone. And that includes, of course, queer, trans, two-spirit folks. Audience, do you have other questions or comments for these wonderful, knowledgeable, generous panelists before? Oh, you have a thank you there. And I think that we will, of course, get on board with supporting the work that Dr. Madill is doing here at the DSA, try to provide all the support and advocacy so that we have a great, strong, robust curriculum where these issues are embedded in a scaffolded way that makes sense, that is significant. Oh, Jemma is generously offering to continue the conversation too. So you have that too. And I just feeling very kind of like hopeful as we approach the end of this conversation. But I want to ask you, how are you, if the panelists want to share some last thoughts, or the audience, if you want to share you're taking away from today or some thoughts about how we're moving forward with this work.
I'm very heartened to see that there is movement forward in this area. It gives me hope that in the future, maybe the near future even, there can actually be positive progress towards queer folks having timely access to healthcare.
Erin, do you want to mention our collaboration with the students in the blog that you shared there?
Sure, yeah, we had initially invited some students from there's a new queer health student group, as well as the gender equity in medicine student group. And they were not able to come today just because of clinical placements that they were in. But they did write a lovely blog about the work that their student groups do. And we're going to be posting that later today. So the link there right now will take you to last month's post, which is also a lovely post about student group involved in harm reduction. But use that link again later today or in the next few weeks if you want to learn about those student groups since they were unable to be here today. Oh, looks like Joanna actually posted there. Maybe it is ready to go. Thank you, Joanna.
I just have one last quick comment. Out Saskatoon has a trans care fund where people can donate money for people who can apply for it to get gender affirming care because it's not free. One of the hopes or something that I imagined was, what if there could be med students who volunteered to fundraise, to learn about why is there a trans health care fund in the first place? What is it? Why? why are things not covered? What are the barriers that folks are facing? What do those look like?
Thank you for that, Jemma. I quickly found the link and put it there, but I think you're right. That would be a great connection for our students to make. And yeah, this is how we do it. We build connections in these very siloed structures that we've been put in. We oppose that isolation and work like little bees cross-pollinating spaces. Are there any other final thoughts or comments or something that I forgot to share about what we're doing, Erin? Well, I'm just so grateful for our panelists today. I'm so grateful for the people in the audience that showed up to learn. And we hope to see you coming back. And we will be sending an evaluation with your feedback and maybe potential issues that you want to see us talking about. And yeah, we hope to see you soon again.